Welcome to the Dynamic Learning Hub of XLR at Andheri East. A prime spot conveniently located at just a 5-minute walk from LIC Andheri Metro. In our journey of over a decade, we have proudly trained over 2 lakh students. We have also been recognized by Thyroid, Silicon India and other accreditation bodies. Experience learning like never before in our spacious and comfortable classrooms. With high-definition projectors and state-of-the-art acoustics in place, we ensure effective learning even to the farthest point in the room. A hybrid mode is a game changer as you can enjoy the benefits of a live classroom from the comfort of your home. Even if you happen to miss any classroom session, you can still attend the same session with the same trainer at the same time at your convenience, maintaining consistency in your learning progress. Want to get started? Join us for a demo or career chat over a cup of coffee at our Andheri branch.
Good evening, all. I hope my voice is audible.
Yeah, hello.
Yes, ma'am. Good evening.
So, shall we start?
Yeah, yes, sure, ma'am. You can start for them.
Yes, okay. Good evening, everyone. So, today is day 3. So, can we just recap what we have studied in last 2 days? Yes, everyone? What we studied in last 2 days, anyone wants to just put in the chat box? Yes, what we have studied, put it in the chat box, please. We studied about what is medical coding, right? Then what is the purpose of medical coding? Why we do medical coding? What are the different career opportunities that we have? Good evening, everyone, right? What we have studied, tell me, yes? Objectives of career, okay. 3 different coding systems that we have studied, ICD, CPT, HCPC is the structure, who publishes them, when are they updated, right? Which are the governing bodies? What is the structure of the book? Of course, we have studied about the medical terminology. You forgot? Everyone? Did you forget? Yes, medical terminology, right? What are the suffixes? What are the prefixes? what is root term, how they are formed, how the medical term is formed, right? So let's begin for the next session, that is medical coding and anatomy. Because without the knowledge of anatomy, it is very difficult to understand the patient's record, right? Medical record. You need to have at least a basic knowledge of anatomy and physiology so that you can read the basic patient's record and understand it and understand the diagnosis, understand the terms. So it is very important. So let us start. What do you think anatomy means? What is anatomy and what is physiology? Can anyone just tell me what is anatomy, what is physiology? Yes, you all are from the life science background, right? So tell me what is anatomy, what is physiology? People who are from pharmacy. Yes. Anatomy is structure of internal organ. Yes. Physiology is the study of functioning of the body. Very good, correct. Anatomy is the study of structure of human body. Physiology is the study of functions of human body. Now there are basic terms which you must know before going to start to study the anatomy. Some functions, some basic terms. Cell. What is cell? Cell is the functional unit of all the living organism, right? Cell is the functional unit of all the living organisms. So it is also the basic functional unit of body. Similar types of cells, they combine to form a tissue. Similar types of tissue or different types of tissue, they combine to form an organ, and this organ performs a specific function. Different organs, they join together to form the system to perform a function. For example, you can see how it is there. This is at the chemical level. Then you can see this is cell. Okay. At the cellular level, these multiple cells, they come together and they form a tissue. Now this tissue, multiple tissues, they come together, they form an organ, right? This is stomach. Multiple organs, they come together to form the system. And multiple systems, they come together to form the human body, right? So these are some of the basic terminologies when we start working on the anatomy. What is physiology, anatomy, what is cell, what is organ, tissue, and system. So this is very basic. I am sure everyone knows this, right? So let's see some of the terms which we refer in anatomy as when we are referring to the position of particular organ or any bone or any system in our body. So just see in the diagram how it is defined. Okay. Anterior and posterior are also called as ventral and dorsal. Something that is just on the front side of the body. That is anterior or ventral. Okay. Something that is behind on the back side of the body, it is called as dorsal or posterior. These are related to the positioning of the different organs. All right. Superior, something which is going towards the head is superior. Going towards the legs or extremities is inferior. Any organ or any vein or any nerve which is, or any bone which is near to the central axis. This is the central axis. You can see the blue line. That is the central axis of your body. If it is going towards the central axis, it is medial, and it is going away. Any muscle or any nerve or any bone going away from the central axis is lateral. So these are the positions. Okay, these are the anatomical terms refer to different positions. Right? Is this clear? Very simple, right? Now let us understand different body planes, because when we are studying the ICD codes or everything, so you will have to understand different planes also. When we go in the CPT codings, that is procedural codings. So if you divide the body from the central part in exactly two halves, you can see the purple one. Exactly two halves. This is called as the mid-sagittal plane. Right? It divides your body exactly in the two halves. that is mid-sagittal plane. The plane that divides your body in upper part and lower part, that is transverse or horizontal plane. Yellow one, you can see transverse or horizontal or axial plane. And the thing which divides your body, or the plane which divides your body in anterior and posterior. The anterior, that is the front side, and the posterior, that is back side, that is called as the frontal or coronal plane. So these are the three different planes. When we are coding for the CPT, we will have to know the understanding of the different planes of your body. Okay, now let us see what are the basic cavity. What do you mean by cavity? What do you mean by cavity? Yes. What is the meaning of cavity? Yes, MBA students can join. Yes, of course. Okay. Yes, vacuum, a hollow space, a vacuum or an empty space, that is cavity. Right. So let us see how many cavities are present in our body, not the dental cavity. Okay. The dental cavity is an abnormality. These are the normal cavities which are present in our body, and they hold some organs, different organ system. So now you can see here in the yellow and gray, orange portion, that is cranial cavity. That is called as the cranial cavity. This cranial cavity contains what? What do you think the cranial cavity can contain? The cranial cavity and vertebral canal. These are the cavities. What do you think it can contain? Brain. Brain. Yes, cranial cavity contains brain, and vertebral canal contains spinal cord, right? It contains spinal cord. Okay. After that, you can see thoracic cavity. What do you think a thoracic cavity can contain? Can you think of it? Which organs thoracic cavity has? Lungs, heart. Yes, lungs, heart, sternum. That is a bone which is present in the thoracic cavity. Ribs. Okay, thoracic cavity contains ribs, lungs, heart, sternum. Right? Okay. Then you can see abdominal cavity. Now this abdominal cavity is again, it is further divided into abdominal and pelvic. This is together called as abdominopelvic cavity. Together called as abdominopelvic cavity. What do you think, or can you just name the organs that are present in the abdominal cavity? Stomach, okay. Duodenum, okay. Pancreas, right. Large intestine, small intestine, all right. Liver, very good. All right. Intestines, yes. Large intestine, yes. What about kidneys? Yes, kidneys, all right. Yeah, gallbladder, kidneys, okay, okay, fine. And what are the organs in the pelvic cavity? Organs in the pelvic cavity, can you name them? Yes, urinary bladder, okay. Uterus, all the organs of reproductive system, correct. Reproductive organs, right? They are present in the pelvic cavity. So these are the cavities that we have, and this thoracic cavity is further divided into the pleural cavity and pericardial cavity. The name itself suggests the pleural cavity has lungs and pleura, and pericardial cavity has heart. Anything related to heart is cardium, right? So pericardial cavity has heart, and pleural cavity contains lungs. So these are the different body cavities. Again, when we study the CPT, we will have different approaches to different organs through different cavities. So you should know the names of the cavities, right? Is this clear? Shall we move forward? All right. Okay. Now let us see some components of the blood. What are the components of the blood? Components of the blood? 45% of the blood is made up of blood cells and 55 is plasma. What is plasma? Plasma is a clear fluid, okay? And WBCs, RBCs, they are the blood cells, okay? WBCs, RBCs, and platelets. Do you know another names for these cells? Do you know another names of these cells? What is the name of RBC? RBC? No, leukocyte is not RBC. Erythrocytes are RBCs, right? Erythrocyte. Erythro means red. Okay, erythrocytes, red. Erythema, red. Erythrocyte, red. Okay, reddishness. Leukocytes, yes, WBCs. And what is platelets? Have another name. What other names are there? Right, very good. Platelets are thrombocytes. Thrombocytes, leukocytes, and erythrocytes. These are the three types of cells that blood contains. Now, what are the functions of these? What are the functions of these blood components? The primary function of RBC is to carry oxygen in the body. WBCs or the leukocytes, they fight infections and inflammations, right? They are the soldier cells of our body. There's the soldiers of our body. Any infection, any inflammation comes, the WBCs get activated. Platelets, they are responsible for blood clotting, to stop the bleeding, right? They're responsible for blood clotting. So these are the functions of RBC, WBC, and platelets, all right? Now, where are these RBCs, WBCs, and platelets are produced? Can anyone tell me from where they come in the body? Who produces? Bone marrow. Very good. Very good. Bone marrow produces the RBCs, WBCs, and platelets. And where they get destroyed? Any idea? Where are they destroyed? They get destroyed in spleen. All of them? All of them get destroyed in spleen, liver, okay? Okay, so RBCs get destroyed in spleen. WBCs get destroyed in? All right, let's see. What is the lifespan of these WBCs, RBCs? RBC's lifespan is 120 days. And after 120 days, they get destroyed in the spleen, right? White blood cells approximate times lifespan is 13 to 20 days, and they are destroyed in the lymphatic system. And platelets lifespan is 3 to 5 days, and they are removed from the bloodstream and they're filtered when they reach the end of their life. Okay, so these are the lifespans of these three blood components and how they are destroyed in our body when they reach the end. Okay, these are all the basic things that we have studied, right? Okay, can anyone tell me the difference between the artery and the vein? What is the artery and what is the vein? Can you tell me, please? Anyone? Yes. What is artery? Arteries carry oxygenated blood. Arteries carry oxygenated blood, carry blood away from the heart. Veins carry deoxygenated blood. Arteries thick, while is thin. Most of the people, I said, artery carry oxygenated and veins carry deoxygenated, but that is not the truth. Pulmonary veins, they carry the oxygenated blood from the lungs towards the heart. Pulmonary vein, artery carry blood away from the heart. Artery carries blood away from the heart. All right, artery means there is nothing like deoxygenation and oxygenation. Okay, it has nothing to do with oxygenation and deoxygenated. Keep this in mind. Arteries are those vessels that carry blood away from heart towards the periphery, towards the body. That is artery. And vein carries blood towards the heart. Right? Vein carries blood towards the heart, and that's why pulmonary vein. Why? It is carrying blood towards the heart, though it is oxygenated blood, but it is carried towards the heart. So the vein and artery difference, most of the time when you go for the interview as a fresher, this difference is asked. Okay, this is a very basic difference, right? So keep this in mind. It has nothing to do with the oxygenation and deoxygenation of the blood. Arteries are the blood vessels which carry blood away from the heart, and veins are the blood vessels that carry blood towards the heart. Keep this in mind. All right. This is a typical interview question. Very basic questions are asked. All right. Let's see. Match the following. First, you can just write the sequence of this. Done? Done? Okay, yes. CADBE. CADB. All right, yes. Okay, okay. Okay, very good. Right, all right. Yeah, first tell me now, what is the function of RBC? Function of RBC? Oxygen transport. Function of WBC? WBC? Defense, immunity, defense, fight. Soldier cells, develops immunity, fight infection. All right, okay. Platelets? Blood clotting, okay. Blood coagulation, blood clot, okay. What does cranial cavity contain? Brain. Okay. RBCs are produced in bone marrow. All right, so these are just the basic things that we have seen. Very basic anatomy, RBC, WBC, artery, vein. What are the different terms? What is lateral? What is medial? What is anterior, posterior? Right, so ready to start learning about the systems of your body? Yes. How many systems are there in your body? How many systems are there in human body? 11, a lot. Okay, 9, 11, 9, 5. Okay, name them. Name the systems. Come on, first. What are the different systems? Tell me, name the system. Digestive, nervous. Okay. Reproductive, respiratory, circulatory, skeletal, muscular, urinary, excretory. All right, skeletal, nervous system, cardio system. All right, everyone is right. Okay, what about the skin? What about skin? Skin, subcutaneous tissue, what it is called as? It's called as integumentary system, all right? Integumentary system, right? So what, how many systems are there? Skeletal, musculoskeletal, or sometimes they take it both differently, like muscular and skeletal, cardiovascular, respiratory, nervous, lymphatic system, integumentary system, digestive system, excretory system, and the very important is endocrine system. Endocrine system. So first we are going to study about endocrine. The reason to study about endocrine first is endocrine system is the first system that is given. Of course, the first few chapters are for the infection, neoplasm, and blood related disorders in ICD. Okay, ICD gives the systems are given in a way. The first chapter is about the infectious diseases. Second chapter is about the neoplasms and the cancers. We will be studying about the neoplasm and the guidelines of the neoplasm, how to code and how to assign the codes. But first, few things as a part of anatomy we need to learn before we actually go and learn about the ICD codings, right? And after that, blood and blood related disorders are given. That is the fourth chapter. And after that, there is the disorders of the metabolic disorders. That is, metabolism disorders are given. That is for the endocrine system. So these are the chapters which are given in ICD, and we will be studying anatomy according to that. Just the basic anatomy that you are expected to know, the terminology that you are expected to know, and some of the common pathologies or common disorders that you are expected to know. That we are going to study in these 2 days, that today and tomorrow. All right. So ready for studying endocrine system? What does the endocrine system means? What do you mean by endocrine? What is endocrine? Endo means within the blood, and crine means secretion. The glands or the organs which secrete their secretions within the blood, directly within the blood, they are called as endocrine glands. They are also called as ductless glands because they do not have duct. The secretion is directly released into the bloodstream. Okay, so they are endocrine glands. And what do you think can be exocrine glands? Now, looking at the endocrine, you know what endo means. And look at the terminology and think about exocrine. What does exocrine means? Exo means outside. Yes, they need ducts, they need tube. It is outside the blood. Yes, they have duct, right? So this is exocrine. Can you name any of the exocrine glands? Sweat gland, you said, okay. All right. Pancreas, salivary glands are right. Adrenal glands are not exocrine. Ovaries are not exocrine. Tear glands, okay. Gallbladder, tear glands, pancreas, some part. We will be studying. All right, okay. So this is the network of glands and organs which makes the endocrine system, right? And they produces hormone. So what does hormone means? It means to set in motion, right? You know harmony. We call that our body is in harmony, right? What is this harmony? It means you are in proper balance, you are in proper motion. That is hormone. This is the meaning of hormone, right? Now see, this is endocrine system. This is endocrine system. You can see which organs are there and which glands are there. Hypothalamus, okay, which is in the brain. Pineal gland, pituitary gland, thyroid gland, parathyroid, thymus, pancreas, some part of pancreas, not the whole of pancreas. Pancreas has both endocrine and exocrine part. Okay, so pancreas, endocrine part secretes insulin and glucagon, whereas exocrine, they secrete digestive juices, and there is a pancreatic duct which opens into small intestine. And these pancreatic juices or the digestive juices are released into intestine. So it has both the functions, endocrine and exocrine. Okay. Adrenal glands, which are just sitting on the top of the kidneys. All right. Ovaries in female and testicles in male. These are the system, these are the organs and the glands, they make endocrine system. Right? Let us see the functioning of each. What is the important function of each of these glands, right? Okay. See where they are situated. First, we see hypothalamus. Hypothalamus, you can see, is this part of the brain, just in the limbic system. This area is called as the limbic system. When we cut the cerebrum from the midline, that is sagittal plane. What was that? Mid sagittal plane. So when we cut it in exact two halves, you can see here the limbic system, and there is a hypothalamus. This portion is hypothalamus. All right. So this is the this is hypothalamus is an organ. Okay, it's not a gland, it's an organ, but it functions to produce the hormones. All right. And a very important function of this is inhibiting, like it maintaining the negative feedback. This is the very important function of hypothalamus. What is maintaining the negative feedback? That when these pituitary gland, thyroid gland, they secrete their secretions. Okay, when they secrete their secretions and the hormone level which is optimum or which is necessary for the body to function, to set in motion, is reached. When this level in the blood is reached, this hypothalamus give negative feedback to the pituitary gland, thyroid gland, or other glands to stop their secretions, to stop the further secretions, so that that level of hormone is maintained in the body. This is very important function of hypothalamus. Of course, apart from that, it is the center which maintains body temperature, hunger, thirst, all your natural desires or natural urges. Okay, thirst, emotions, adjustment with the environmental temperature, right? So this is the function of hypothalamus. It regulates body temperature, your hunger, your thirst, your sleep. All this is managed by hypothalamus. All right, and it controls the pituitary gland through releasing and inhibiting hormones. Okay, it controls the secretions of the pituitary gland. Now, pituitary gland. Pituitary gland, you can see a very small, just like, grain. It's just like a grain. It's a green color structure you can see, right? This is pituitary gland, a very small structure, just like a grain. But it is called as the master of orchestra. It is called as the master of orchestra. Why? Why? Because it secretes it secretes 7 or 8 hormones, which in turn helps all other endocrine glands to secrete their secretions. It stimulates all other glands. And that's why it's the master of all the glands. It's the master of orchestra, right? It maintains all other glands. We'll see what are the secretions of this small gland, pituitary gland, which is the master of all the glands. See how it controls. It controls adrenal cortex by secreting ACTH, that is adrenocorticotropin hormones. Okay, adrenocorticotropin hormones. This has again 2 different lobes, anterior pituitary and posterior pituitary. You can see the purple one is anterior pituitary and the greenish one or blue one is posterior pituitary. Posterior pituitary primarily secretes only 2 hormones, that is oxytocin and ADH, antidiuretic hormone, which in turn stimulates the kidney to restore the water balance, right? This is the function of antidiuretic hormone. Oxytocin, which secretes the mammary, which stimulates the mammary glands. Okay, mammary glands, which stimulates the mammary gland. Oxytocin, secreted by posterior pituitary, stimulates mammary glands along with the prolactin. Oxytocin and prolactin together, they stimulate mammary glands. Now you can see gonadotropins. The name suggests gonadotropin means the hormones which are stimulating gonads. Gonads means reproductive glands. Reproductive glands. All right. So gonadotropin, follicle stimulating hormone in female, which in turn stimulates. See, all these hormones are stimulating. FSH, TSH, MSH. They are all stimulating another gland. Right? Stimulating this. Testosterone, stimulation of this. Right? This is the stimulation. right? TSH, thyroid stimulating hormone, stimulation of the thyroid. MSH, melanin stimulating hormone, melanocyte stimulating hormone. What it does, it stimulates the skin to create pigmentation. What is the pigmentation? That is melanin. Okay, the melanin gives pigmentation to the skin. So melanocyte, they secrete melanin. Okay, melanocytes, they secrete melanin, which gives pigmentation to the skin. Growth hormone responsible for the growth of bones and muscles. And ACTH, that is adrenocorticotropin hormone. These are responsible, which stimulates the adrenal gland, which in turn releases the hormones. They are also called as stress hormones. Okay, stress hormones. So this is why it is called as the master gland. See how many hormones are there, right? Now this TSH that was secreted by pituitary, it will stimulate the thyroid gland. The thyroid gland, which is, you can see this structure is thyroid gland. Okay, this structure is thyroid gland. It stimulates thyroid to secrete T3 and T4. These are the two secretions of the thyroid gland, T3 and T4. That is triiodothyronine and thyroxine. To regulate, what is the function is metabolism. To regulate the metabolism, control heart rate, body weight, and energy level. And it secretes calcitonin, which regulates calcium. So there are three different secretions of the thyroid gland: calcitonin, thyroxine, triiodothyronine, that is T3, T4, and calcitonin. These are secreted by thyroid gland. But there are small glands, you can see, four small, just very small glands. These are parathyroid glands. These are parathyroid glands, and they secrete PTH, parathyroid hormone. It regulates the calcium and phosphorus level in the bone. Regulation of the minerals, that is calcium and phosphorus. Okay, it maintains calcium and phosphorus level in the blood and bone. So this is the main primary function of parathyroid. And there is a very small gland, pineal gland. You can see here, pineal gland just near the cerebellum here, below the thalamus. This is thalamus, just near thalamus. You can see this is a pineal gland, very small, even smaller than pituitary. This gland is responsible for sleep-wake cycle. It produces melatonin. Melatonin and melanin are both different things. Okay, melanin gives pigmentation to your skin, and melatonin is important for your sleep-wake cycle, right? Adjusting, like whenever the day is long or the night is short or the night is long, how your sleep-wake cycle is maintained? It is maintained through the melatonin secretion by the pineal gland. Okay, this is the secretion of pineal gland, melatonin. All right, so we have seen function of hypothalamus, regulation of body temperature, hunger, thirst, all natural urges. Pituitary gland, many functions, master gland. We have seen thyroid, T3, T4, that is for the metabolism. All right, then parathyroid for regulation of the calcium and phosphorus in the blood and bones, and pineal for sleep-wake cycle. Anyone, any doubt, anything you want? Okay. Now the next hormone is, next endocrine gland is thymus. This thymus is just near the heart. You can see in the diagram, just near, just above the heart. This is trachea. Now this thymus gland is only active till the puberty. What is puberty? Till the maturation, right? Till the sex organs are developed. Until that only this is active. After that it is not. It turns into a fat it turns into a connective tissue or fat-like structure. Okay, it converts into a fatty structure. So it is active only till, you can say, on an average 12 years of age, because after that the maturation starts, right? So what is the main function of this thymus is it produces the thymosis, which is responsible for development of the immune system, T cells, maturation of the T cells. This is very important. This is just near the sternum. This is not just near sternum, right? And it is very important because it gives immunity till the age of 12 years. It is mainly active in childhood and adolescence. After that, it turns into a fatty structure, right? Then pancreas. All right. Now you can see pancreas here. All right. Pancreas here, you can see just near the liver. Just below the liver, there is pancreas. This pancreas has two different functions. It has endocrine function and it has exocrine function. So endocrine, they secrete insulin and glucagon. Insulin and glucagon, they work together to regulate blood sugar level. Insulin is released to absorb the blood sugar. If the blood sugar levels are low, glucagon is released to maintain the blood sugar. Right? Insulin lowers the blood sugar while glucagon increases the blood sugar. And this is the endocrine part. And exocrine part of pancreas, they secrete digestive juices. And these digestive juices are carried by the duct. So pancreas has duct. Which are the cells which secrete insulin? Anyone has any idea? There are typical, very specialized cells in pancreas which secrete insulin. Beta cells of islets, beta cells of islets of Langerhans. Pharyngeal cells, no. Beta cells of islets of Langerhans, yes. Beta cells, they secrete insulin. And alpha cells secrete? Are you sure alpha cells? Alpha cells secrete? Alpha cells secrete glucagon. All right. Very good. So beta cells, they are responsible for the secretion of insulin. Beta cells of islets of Langerhans. All right. Okay. So the function of thymus and function of pancreas is clear, everyone? Yes? All right. So now very important is the function of adrenal glands. This adrenal gland, you can see it is sitting just on the top of kidneys, just like a cap on each kidney. So that is a pair of adrenal gland, right? This adrenal gland has adrenaline cortex and medulla. So cortex is like the outer structure and medulla is the inner structure, right? If you cut this adrenal gland, you will find cortex and medulla, and they both secrete different hormones. They both secrete different hormones. One is cortisol. Everyone is aware that because of stress, there are so many, you say that diabetes is because of stress. Why people get diabetes is because of stress. Why? Because cortisol is responsible for regulation of sugar metabolism, glucose metabolism. Okay, cortisol is responsible for stress response. What happens when you are in stress? What happens when you are in stress? Can anyone tell me? What is your stress response? Say, for example, you are under stress that you have to prepare yourself to run. What happens in that condition? What are the stress responses you feel? When you are under stress, what are the responses? What physiological changes you experience in your body when you are in stress? What are the physiological changes that you experience in your body? You feel increased heart rate, increased respiratory rate, palpitation, right? Yes, increased blood pressure, restlessness, these are the stress responses. So this cortisol is responsible for the stress responses, right? Yes, increase in the adrenaline. Adrenaline and noradrenaline, they are secreted by medulla, the part of adrenal gland that is medulla. And these are called as the fight or flight response. These are called as fight or flight response. What is fight or flight response? Flight. If you are faced with a tiger, what you will do? You will fight or you will fly? Flight, right? You will run. Right. Okay, run away. That is flight. That is a flight response. All right. If you are angry with someone and you need to express your anger, what you will do? Fight, right? So that is fight and flight response. And for that, adrenaline and noradrenaline are responsible for that. Now, aldosterone is also secreted by cortex, that is adrenal cortex, which is responsible for the control mechanism of the blood pressure. It regulates sodium and potassium levels in the body. So by maintaining the mineral levels in the body, it maintains the blood pressure, right? So many a times blood pressure can be because of the certain problems in adrenal glands or certain problems in the secretion of aldosterone. So we'll be seeing that what are secondary hypertension, what is primary hypertension. In the coming sessions we will see that, right? So that can be the reason for blood pressure. All right. So these are the secretions of adrenal glands, and finally the secretion of gonads. Now what are gonads? Gonads means what? What are gonad? Reproductive organ or the organs of reproduction. Yes, ovaries, testes, reproductive organs. Rather than that, we will say reproductive glands or glands which secrete the reproductive hormones. All right, reproductive hormones. Reproductive organs are many different. These are the reproductive glands which secretes reproductive hormones. So ovaries in female. Where are they placed? Where are ovaries? In the pelvic cavity. They are in the pelvic cavity. Now, what is the function? The function or the secretion is estrogen and progesterone. This estrogen and progesterone are responsible for maintaining menstrual cycle, pregnancy, right? And estrogen is responsible for development of the secondary sexual characters. Now, what are secondary sexual characters in female? Estrogen, progesterone, they together regulate the menstrual cycle and important for pregnancy. Along with that, there is one more hormone called as luteinizing hormone, LH. Luteinizing hormone, but that is not a secretion of ovaries. That is a secretion of pituitary. Secretion of pituitary, right? What is the secondary sexual characters? What do you mean by? Because this is again is present in males also. Body hair, secondary sexual characters, enlargement of the breast, yes, breast development, voice, high pitch voice, enlargement, yes, voice changes, correct, correct. Weight gain, okay, weight disposition in thighs and muscle, cracking of the voice, very good, okay. Pubic hair in males, it is beard, mustaches and beard, okay. These are all the secondary sexual characters. So estrogen is responsible for secondary sexual characters, okay. And in males, testes, that is located in scrotum, the function is to produce the testosterone, which controls sperm production, libido and sexual characteristics. So these are the different organs of endocrine system. Everyone clear with these organs of endocrine system? Right? Okay. So now what are the different pathologies, common pathologies? Any abnormal level or abnormal secretion of hormone, it will be hyperthyroidism, hyperparathyroidism, hyperinsulinemia. Any abnormal level of the secretion will be hypoparathyroidism, hypothyroidism. All right. Now I'll ask you one question. TSH is secreted by whom? Which gland secretes TSH? Thyroid stimulating hormone. Which gland secretes thyroid stimulating hormone? Thyroid gland secretes thyroid. Yes. Pituitary secretes. Pituitary secretes thyroid stimulating hormone and it stimulates the thyroid to secrete the secretions of the thyroid gland. What are the different secretions of the thyroid gland? T3, T4, calcitonin. T3, T4 and calcitonin, right? Calcitonin. So TSH is secreted by pituitary, right? Now, if you have a record of a patient which says the TSH level in the blood are increased, TSH level in the blood are increased, what do you think it can be? Is it hyperthyroidism or hypothyroidism? Hyperthyroidism, hypo. Those who are saying hypo, why? Can you explain why? Why do you think it is hypothyroidism? Why not hyperthyroidism? T3 and T4 does not decrease. I am not saying they are decreasing. I am just saying TSH is increased. There are no changes in T3 and T4. There are no changes in T3 and T4 level. Just TSH is increased. There might be negligence. It may indicate some disease. That's what I'm asking. What it is? Is it a thyroid? Okay, let me tell you. This is hypothyroidism. Those who have written hypothyroidism, it is right. Because what? As TSH is increased means what? Pituitary is trying to stimulate thyroid more and more and more, and thyroid is not responding. All right, thyroid is not responding means thyroid is hypoactive. Thyroid is hypoactive, is not responding to TSH. Right, that's the reason increased TSH level indicate hypothyroidism. Increased level of thyroid secretion, that is hyperthyroidism. T3, T4 levels are increased, hyperthyroidism. But increased level of TSH, that is hypothyroidism. Got everyone? Got it? Again, this will be asked in interview. Why it is hypo? Okay. Or you will be shown a report of a patient where the TSH level are increased, and you will be asked, tell me whether it is hypothyroidism or hyperthyroidism. So keep it in mind, if the levels of TSH are increased, it is hypothyroidism. Okay, because TSH is a secretion of pituitary. Pituitary is trying to tell that, okay, work. It is trying to tell thyroid that, okay, please work more, work hard. Thyroid is hypoactive. So that is hypothyroidism. All right. So these are hyper and hypo, that is abnormally low levels of hormones. They have their different projections and manifestations, or the signs and symptoms. Now, as we have studied the functions of all the organs, you can understand what will happen if there is increase, or what will happen if there is a decreased secretion, right? How it will affect, right? So now, very favorite thing, right? Recall, shall we? Shall we recall before we go to next section? All right. All right. All right. So tell me the first question. Primary function of the pancreas in endocrine system. Produce insulin and glucagon. All right. Okay. Okay. Next question. Which hormone is released by the adrenal glands during fight or flight response? Epinephrine. 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 Okay. Okay. Which hormone is produced by thyroid gland to regulate metabolism? T4. 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 All right. Okay. Next question. Which gland is known as master gland? Pituitary. Pituitary. All right. All right. All right. All right. Okay. Okay. Pituitary. It's pituitary. Okay. The pineal gland produces melatonin, right? True. Hypothalamus is directly responsible for production of the thyroid hormone. Last question. Hypothalamus is directly responsible for. Then how does it affect the thyroid hormone? How does it affect? Does it affect or not? Is it responsible for the production of thyroid or not? Is it? It is? Is it responsible or not? Indirectly related. Yes. Hypothalamus, it gives the negative feedback to pituitary and thyroid, right? It works as a negative feedback mechanism. It gives a negative feedback mechanism. So it is indirectly responsible, not directly responsible. Okay, very good. So I hope everyone is clear about the different pathologies and different systems and different functions of the endocrine system. Yes? Ready to study about nervous system? Yes. Okay. You tell me, what are the organs of nervous system? Which are the organs of nervous system? Neurons, axons, dendrons. Okay, brain, right? Yeah. Brain and spinal cord. Yes, brain and spinal cord. Okay. Central nervous system, brain, spinal cord. Right. All right. Neurons, dendrons, axons, they are the functional unit. They are the cells of nervous system. I'm asking about the organs of nervous system. Organs of nervous system, nodes of Ranvier. Okay, heard first time. All right. Brain, spinal cord, and all the peripheral nerves. Brain, spinal cord, and all the peripheral nerves, they make the nervous system. Now, this nervous system, what is the function of nervous system? Can anyone tell me what the nervous system does in our body? What is the role of nervous system in our body? Yeah? Yes, it communicates the signals, right? It communicates the signal and coordinates the signals, regulates all the functions of the body, hormones and everything, right? This is carrying the electrical impulses or the signals from the periphery towards the brain and from brain towards the periphery. This is the important function of central or nervous system, right? What is the important thing is electrical messages called impulses. They are carried to and from both. They are carried to the nervous system, central nervous system, and carried from the nervous system to peripheral nervous system, CNS to PNS. All right, and it senses changes in the internal and external environment. Internal environment means all the hormones and everything, right? It communicates and regulates all the body activities and coordinates. So very complex but very sophisticated organized system. Now this nervous system is further classified into two things, that is central nervous system and peripheral nervous system. The central nervous system is made up of brain and spinal cord, and peripheral nervous system is made up of cranial nerves and spinal nerves. All right, so let us see. You can see your brain, spinal cord. This is central nervous system, and these are cranial nerves and spinal nerves. They form the peripheral nervous system. Now we'll see how this functions, because this peripheral nervous system is further divided into motor and sensory. Motor and sensory division. And this motor division is again subdivided into autonomous nervous system and somatic nervous system. Autonomous nervous system and somatic nervous system. Now, this autonomous nervous system is further divided into sympathetic and parasympathetic division. So, these are all the divisions of peripheral nervous system. Okay, central nervous system, there is only one thing, that is brain and spinal cord. But peripheral nervous system has a sensory division and a motor division. And again, a motor division has further autonomous and somatic nerve. And then again, this autonomous has sympathetic and parasympathetic divisions. Now, what are the functions? How this work? Okay. Now, for example, if you touch any hot object, maybe a flame or maybe an iron or something like that, which is very hot, what will happen? The sensory division of your peripheral nervous system, will give impulse to peripheral nervous system. It will capture that impulse and it will give it to the central nervous system, that is brain. This impulse will be carried from spinal cord towards the brain. Now this brain will give response. These signals are relayed in the brain, in the part of the brain that is called thalamus, which is the part of the brain where all these signals are relayed, right? Then this brain, that is central nervous system, will give signal or order to peripheral nervous system. Which part of the peripheral nervous system? The motor division of the peripheral nervous system. The motor means which works on the muscles and glands. Okay, which works on the muscles and glands. So from the central nervous system, this will come to the motor division of peripheral nervous system. Now from motor division of peripheral nervous system, it will go either to the somatic or to the autonomous. Now if this is as I told, it is a sensation of heat, right? This is a sensation of burn or heat. So what will happen? This motor division will tell the somatic nerve. This will give the impulse to somatic nerve to immediately remove that hand from the flame, right? So that is the voluntary control muscles. Okay, that is a somatic division. Now, if this is not the sensation, okay, if this is not heat or anything, it is just an emotion maybe, or if it is just the sensation like palpitation or anxiety. Now what will happen? This will come to the motor division and it will go to the autonomous nervous system, which gives impulses to the organs and gland. Now this autonomous nervous system will decide whether this is the emergency function or whether this is a non-emergency function. Right? I said if you face with a tiger or a lion, all right, so it is emergency situation. Now your sympathetic division will be activated. That is in the emergency situation where you have to run. All your body will be ready to learn. Your glucose level will be increased because you have to run. Your respiratory rate will be increased. Your heartbeat will be increased. Your body will be prepared to run. Right? So that is the sympathetic division. If it is just an emotion, you are seeing it from the far, nothing is happening, it will go to the parasympathetic, which is a non-emergency action. Non-emergency functions like there is no emergency, your respiration is at rest, the digestion that is happening in your body, the excretory system that is working in your body, that is not emergency. There is no emergency of that, right? So parasympathetic division, it controls all the non-emergency functions. So this is how central nervous system and peripheral nervous system, they work in coordination. All right. The peripheral nervous system has sensory division, motor division. Motor further has autonomic and somatic. Autonomic further has sympathetic and parasympathetic. So is this classification clear to everyone? Everybody? This classification and the functioning, how the nervous system and central nervous system and peripheral nervous system work? Okay, great. I'll be asking, let me see. All right, so let us see the central nervous system. Okay, the central nervous system comprises of brain. Now we'll see the different parts of brain, right? This is cerebrum, as you all can see. This is cerebrum, which is further divided into 4 lobes, 4 different lobes. Lobes means just a part of it. And how it is divided? Is there an actual division? Yes, there is actual division by a sulcus. You can see a sulcus here, right? Sulcus and gyri. What does that mean? There are folds on the brain. The elevated fold, the elevated part of the fold is gyri. Many are gyri, single is gyrus. Many are gyri, plural is gyri. Singular is gyrus. Okay, so these are the elevated portion of the fold, that is gyri. And the folds, which are the deepening structure, that is sulci or sulcus. Sulci are plural, sulcus is singular. So by these sulcuses, you can see lateral sulcus, central sulcus. This cerebrum is further divided into 4 lobes. Frontal lobe, parietal lobe, temporal, and occipital. These are the 4 lobes of the brain. Frontal, which is near the, you can see the forehead. Okay, parietal, on here, this side of the head. Temporal, just above your ears. Occipital, on the back side of the head. These are the lobes of brain, cerebrum. The portion near this is cerebellum. This is cerebellum. You can see pons, medulla oblongata, and this finally continues as spinal cord. So this is the structure of brain. Now we will see the functioning of each part. Functioning of each part of the brain. Cerebrum is responsible for all the muscle movements, all your voluntary muscle movement, motor functions. Sensory functions, that is interpreting the sensations. Okay, interpretation of all the sensations. And very important is reasoning and logical thinking. Okay, reasoning, logical thinking, emotions and intellectual processes. This is all done in the cerebrum. The frontal lobe of cerebrum is responsible for all emotional and intellectual processes. So these are the functions of cerebrum. Now, what is the function of cerebellum? It's very important. It controls all the unconscious movements in the skeletal muscle. There are 3 organs in our body which are responsible for maintaining our posture and balance. Which are these 3 important organs? Can anyone tell me? Which is important for coordination and posture maintenance? Which are these 3? One is cerebellum. Next 2. Can you tell me next 2? Cerebellum is the one of them. Medulla? No. Spinal cord? No. CSF? No. No. Yes, is anyone? Hypothalamus? No. Forebrain? No. No. Okay. Ear? Yes. Who said ear? Ashish? Yes, right. Ear, and that too internal ear. internal ear, that is the semicircular canal, vestibulocochlear part of the ear, that is internal ear, cerebellum, internal ear, and eyes, the coordination of vision. These are the three important organs which are responsible for maintaining the posture. You do not fall off easily just while walking. And if you do, there is certainly some problem with in these three organs, right? Internal ear, cerebellum, and eyes. These are the three important organs for maintaining the posture, right? Also, cerebellum is important while you to maintain your gait. When you walk in coordination, right? You walk in coordination. You do not walk haywire. So cerebellum is important for coordination of posture, coordination of your movements and posture and balance. Okay. And medulla oblongata, which is this part, which then further continues as the spinal cord. This part is responsible for, it has all the vital reflex center, cardiac center that maintains the heart, the muscles of the heart, okay, muscles of respiration, muscles of heart, and vasoconstriction. What is vasoconstrictor? Vasoconstriction means constriction of the vessels, constriction of the blood vessels. So cardiac muscles, respiratory muscles, and vasoconstrictor are these three important reflex centers. I don't know how many of you are movie freaks, but it was long back. There was a movie of Nana Patekar where he used to say, "यहाँ पे मत मारना, छोटा दिमाग होता है, मर जाता है. यहाँ पे मत मारना." Why this was said? यहाँ पे मत मारना, छोटा दिमाग होता है. I don't remember the movie, name of the movie, but it was there. Okay, so why this is? Because there are very important centers here. Right? I don't know the movie. It's okay. It's okay. We are not here to discuss about the movie, but I want to tell you why it was said, because there are three important reflex centers which are cardiac muscles, respiratory muscles, and vasoconstrictor. So if there is anything, any injury is there to the medulla oblongata, there are chances of sudden death because of failure of these three centers, right? So these are the functions of cerebrum, cerebellum, and medulla oblongata. Anyone wants anything to be repeated? Everyone is clear about this? Right? If everyone is clear, we'll move. All right. Okay. All right. So meninges. What are meninges? Meninges are the covering of the brain and spinal cord. See, all organs in the body, they have covering. Every organ which is precious to your body, it has a covering. Right? Like everything which is precious for you, you keep it in a proper bag, and right? So similarly, every organ which is precious to your body has been kept in a proper bag to avoid the friction and injury. So meninges are to protect the brain from injury, to protect the spinal cord from injury. All organs are covered. Can you tell me the name of the covering of lung? Anyone knows covering of lungs? What are they called as? Pleura. Correct. Covering of lungs, membrane of lungs, that is pleura. Membrane or covering of heart. Covering of heart. Pericardium. Very good. Pericardium. Right? Yes, pericardium. So similarly, covering of bone. Covering of bone. Periosteum. Covering of bone, periosteum. Right? So similarly, covering of brain. Now, brain is such an important organ or such an important structure of the body that it needs a lot of protection. So there are three meninges or three layers of covering which are present. As I told you that the medical terminology has come from different languages, right? It's a mix of languages. So now the names also say you can learn the meaning of it. Dura means tough, durable, durability. We say this is durable. It has a durability, means what? It is tough. It is long lasting. And matter means mother. In German, matter means mother. So dura matter, which is the tough covering. After that, there is arachnoid. Okay, that is arachnoid. Arachnoid is a space. And after that, pia matter. Pia is a delicate. So now, as you know, dura is a tough structure. It is just near the skull. You can see the blue one. This is the outer side is the skull. This is the bone, the skull. The blue one is dura mater. This is just lining the bone, that is skull. After that, there is arachnoid membrane. It is again a membranous structure.
Students, I think trainer has some network issues. That's why she have dropped the session. Kindly wait till she will rejoin back. Kindly wait for a few minutes.
Yeah. So sorry, my system got hung actually. It was automatically shut down, so I had to stop it. Okay, I'm so sorry about it. All right. So let's start. Okay. You can see the screen, everyone? All right. Okay, so we were about to discuss about the meninges of our body, right? So meninges, right? So these are three different meninges, okay? Dura mater, arachnoid membrane, pia mater, and these are also covering the spinal cord. All right, these are also covering the spinal cord. All the membranes, they cover spinal cord and brain to protect it. So dura mater, arachnoid membrane, and pia mater. So now there is a fluid also, which is cerebrospinal fluid. This fluid is present in all the cavities in this brain and spinal cord. It covers it is a fluid which is present in this skull and vertebral column, that is the spinal cord. What is the function of this cerebrospinal fluid? What do you think can be the function of this cerebrospinal fluid? Yeah? Function of cerebrospinal fluid, can anyone tell me? CSF? What is the function of CSF? CSF function is to protect, cleaning of brain. It works as a shock absorber. It works as a shock absorber. Okay, it absorbs the shock because you are jumping, you are moving. So all the time the brain is also moving, right? So it should not get friction with the other parts of the skull, and that's why it has the fluid in it. It has a special function, that is a shock absorber. This is different parts of the brain and spinal cord. Now, can we just go about the different pathologies or common pathologies that this brain or the nervous system has? Okay, different pathologies. Now, what is muscular dystrophy? Muscular dystrophy is a genetic disorder where there is progressive muscular weakness and sometimes even the death of muscles. If you have seen any patients of the genetic disorder, there are patients who are just got very lean and very thin, and this becomes progressive. Some part of their body, some part of their muscle, it gets completely dead. It does not function, and even it loses the mass. The muscle loses the muscle mass. That is a genetic disorder, and it is a progressive genetic disorder, right? It slowly progresses. Once first one muscle gets weakness, then another, then third, then fourth. So it progresses slowly. Now in the picture you can see here, that is the spina bifida. It is also the congenital defect. It is a congenital defect you can see in this picture. This is called as spina bifida. Now what does bi means? Bi means bifurcation. Bifurcation of the spine. That is spina bifida. And what happens here is the content of the spinal cord. These are the contents of the spinal cord. They are coming out of the body. You can see this. This is spina bifida. This is a congenital defect. This can be cured by surgical operation. This is surgically cured. What is stroke? You know everyone. This is a very common term. Very, very common term. What is stroke? Stroke occurs in brain. Of course, we are studying about brain. Stroke is also called as the cerebrovascular accident, CVA. Okay, that is also called as CVA, cerebrovascular accident or cerebrovascular event. It is because of ischemia. What is ischemia or ischemia? What is the meaning of ischemia? Ischemia means less blood supply, low blood supply or low oxygen supply. That is ischemia. Now this ischemia results in death of the muscle. Wherever the blood is not getting supplied, that tissue gets dead, and that is called as infarction. Okay, what is the difference between ischemia and infarction? Ischemia is the low blood supply, and due to low blood supply, there is a death of that tissue, that is infarction. Now, infarction can be in brain, it can be in heart. Okay, that is cerebral infarction and cardiac infarction. Okay, cerebral infarction and cardiac infarction. So it is a death of that tissue. So because of the death of that tissue, that particular part of the brain stops functioning, and that is stroke. Stroke has multiple manifestations. Stroke is a very wide term. It has multiple manifestations. It depends on the area of the brain which has infarcted, which has got infarction. Okay, so area of the brain. So if the stroke is affecting the speech area, so the person may lose his speech. If the infarction is affecting the vision of, or the area of vision, then the vision of the person affected. If there is an infarction in the area of the motor movement, then the person can get hemiplegia or paralysis. What is hemiplegia? Hemiplegia? No, it's not a cancer. Absolutely not. What is hemiplegia? Hemiplegia. Hemi means what? Half. Hemi means half. Hemisphere. Hemi means half, right? Hemiplegia. Plegia is a difficulty in walking or difficulty in movement. So hemiplegia, that is a paralysis of half side of the body. So depending upon which area of the brain has got a stroke or has got an infarction, we will have multiple manifestations. Sometimes it can be very serious if the stroke is in cerebellum or in medulla oblongata, where there are the vital centers or the vital reflexes. Right? So stroke can have different manifestations. This is just a single term, which is also called as CVA, that is cerebrovascular accident or cerebrovascular event. It can be due to any reason. It can be due to hypertension, excessive hypertension, that can result in the ischemia and infarction, and finally stroke. It can be due to any injury. It can be due to the malignancy. It can be due to the tumors. Reasons can be many. All right. So there are different reasons for the stroke and different manifestations of the stroke. So when we study about the guidelines about how to code the stroke, that time we will discuss more about this. Then there can be different tumors or malignancies, different types of brain tumors will be there, different areas will be there. All right, malignancies and tumors, brain tumors. Epilepsy. What is the condition called epilepsy? Have you heard about epilepsy? Repeated seizures. Repeated seizures. Tremors is sort of a Parkinson's. Okay. Repeated seizures. Yes, seizures. Seizure is a symptom, right? Epilepsy is recurrent seizures. Yes, that is epilepsy. Abnormal discharge of neurotransmitters. All right. What are Parkinson's disease? Parkinson's disease. Loss of rigidity, low dopamine. Okay. What are the symptoms? Uncontrolled movement. This Parkinson's disease is also called as movement disorder. Is also called as movement disorder. Okay. There are abnormal movements. The typical Parkinson symptom is pin rolling movement. This is very starting. This is called as pin rolling movement. What are these called as? Pin rolling, just like you're rolling the pins. Okay. So these are pin rolling movements. These are the very typical symptom of Parkinson's. Okay, Parkinson's. Then facial palsy. There are many. Facial palsy, that is the paralysis of face. That is also called as Bell's palsy. Okay, half side of the face is paralyzed, or even sometimes whole of the face is paralyzed. Okay, facial neuralgia. This is also one of the conditions or the abnormalities due to nervous disorders. Facial neuralgia, facial palsy. Okay, paraplegia, monoplegia, hemiplegia, that is the paralysis, quadriplegia or quadriplegia. Okay, so these are different types of paralysis. Hemiplegia, half side of the body is not working properly. Paraplegia, either of the upper limb or lower limbs, they are not working properly. Monoplegia, one of the limb is not working properly, either one of the four limbs is not working. Quadriplegia, all of the four limbs are not working. So these are again the different pathologies. Alzheimer's, very common. What happens in Alzheimer's? Loss of memory. Alzheimer's, loss of memory. Okay, yes, forgetfulness. Dementia. Dementia, Alzheimer's disease, these are all the different pathologies that you will find in nervous system. Now, what all malignancies that you can think of? What do you think? How can you, what can be the signs and symptoms that you feel that you can think that there are certain disorders of the neurology or nervous disorders? What could be the common signs and symptoms that you feel? Numbness, okay. Seizures, okay. Sleep disturbances, tremors, headache, all right. Altered speech, right? Very good. Vertigo. What is vertigo? Vertigo, right? Insomnia, vertigo, right? These are all the common signs and symptoms. Unconsciousness, okay. Then incoordinate movement, right? Then there is no orientation to time, place, and person. No orientation to time, place, and person. Now, what does this mean? Orientation to time, place, person. What does this mean? Illusion is more sort of a mental disorder. Okay, if you have to find out the trauma to the or problems in the nervous system, the physiological and the physical problems, pathological disorders. Orientation to time, place, person means when you are, if I ask you, who are you? What is your name? Who is your father? Right? That is orientation to time, place, person. Right? You are oriented to person. Who are you? Who is your father? If anyone is accompanying with you, if I ask you, who is it with you? So if you are able to answer, that is you are oriented to person. If I ask you, what is the time right now? All right, if you are able to answer it, whether it is morning, whether it is evening, what exactly is the time? So that is, if I can ask you the date also, which day it is. That is orientation to time. Okay, and orientation to place. Where are you currently? And with whom you are right now? So you should be able to tell where is your home, where do you stay, where is your hometown, where do you work. So that is the orientation to place. So orientation to time, place, and person is the first thing a physician analyzes to see if there are any difficulties with the neurological, if there are any neurological disorders, underlying neurological disorders. Okay, these are the signs and symptoms that you have said. Any test, particular test you think you can do? Which test can be there? If you want to analyze EEG, what is EEG? What is EEG? Yeah, what is EEG? Can you just write the full form of EEG? Electroencephalogram. Electroencephalogram. Okay. Right. That is EEG. Then MRI. What is MRI? Magnetic resonance imaging. MRI. All right. What else can you do? Direct MRI, EEG. Can't we go for X-ray? Can't we go for some blood test? Yeah. Directly MRI, directly you will go for EEG. Okay. What is EMG? What is EMG? Not OMG. EMG. What is EMG? Yes, EMG. Electromyogram. Right. Okay. What are nerve conduction studies? To see whether the impulse is properly carried from the nerve or not. That is nerve conduction study. That are also the part of different diagnostic tests. All right. CT scan. What is CT scan? CT scan or CAT scan? CAT scan, CT scan, what is it? Computerized, computed tomography. And what is PET scan? PET? PET scan? Positron emission tomography. Okay, so these are different diagnostic tests. Of course, I have put very few. There are many, like different hormone levels you will be checking, the levels of different enzymes you will be checking. That is different blood test for checking the hormones, for testing the level of different enzymes, neurostimulators, neurotransmitters, then different genetic studies, CT, MRI, EEG, EMG, X-ray, PET scan. These are all diagnostic studies, and one important is CSF testing, cerebrospinal fluid testing. If there are any infectious agents to be found, then that time CSF is tested. Okay, if there are meningitis or any infection like encephalitis, to find out the causative organism, CSF will be tested. That is, CSF is cerebrospinal fluid. And from where the CSF is collected, it is collected from the spinal cord, that is through the lumbar puncture. So these are all the diagnostic tests which are done for finding out the different pathologies. So we'll just do a quick recap what we have studied today, and after that we'll do the test. All right. Now you just first tell me what are the answers to this. Yeah, functions of cerebellum. Functions of cerebellum. Come on, first we have studied. What are the functions of cerebellum? Posture, balance, coordination. Very good. Very nice. Great. Movements, not moments. Movements. Yes, movement. Coordination of movement, posture, balance. All right, this is the function of cerebellum. Right. Why we need meninges? What is the function of meninges? To protect the brain and spinal cord. Protection of the brain and spinal cord. Okay. How many meninges are there? Name them. Name. Dura mater, arachnoid, and pia mater. Dura mater, arachnoid, and pia mater. Okay. What are the subdivisions of nervous system? Tell me, subdivisions of nervous system. First, central, peripheral. Peripheral further divided into. Peripheral divided into this. You are just telling me only two, central nervous system and peripheral. Peripheral is motor and sensory, right? Motor and sensory. Motor is further divided into autonomous and somatic. Okay. Autonomous is further divided into parasympathetic and sympathetic. Okay. Okay. Good. Right. So now write all this. Now you tell me in one message, put everything. Central, peripheral. Peripheral further divided to. Peripheral further divided into sensory motor. Motor further divided into autonomous and somatic. Autonomous further divided into sympathetic and parasympathetic. Very good. All right. What is the function of parasympathetic? Function of parasympathetic nervous system? Non-emergency functions. All the non-emergency functions, right? And emergency functions? Sympathetic nervous system. All right, very good. What is CSF? Cerebrospinal fluid, which is shock absorber. Lobes of cerebrum. 4. Frontal, parietal, occipital, temporal. Okay. Function of cerebrum. Motor function, memory, intellectual, logic and reasoning. Okay. All right. Very, very good. The motor functions of the cerebrum, sending the signals. Okay. So any doubt, any question you want to ask? Otherwise, we will quickly recap. And we will study the remaining few important anatomical structures and systems. Yeah, any question? Anything you want to ask or else? Right? We'll just recap. Function of vasoconstrictor. Vaso is what? What is vaso? If you know the terminology, you can understand. Vaso means vessel, blood vessel. Constriction means contraction of the blood vessel. That is vasoconstrictor. And why we need vasoconstrictions? To prevent the blood loss, to maintain the harmony, that is vasoconstriction. To increase the blood pressure, yes, correct. Okay. Vasodilators means exactly opposite. Okay, vasodilators means exactly opposite. Dilatation of the vessels. These are the enzymes, these are the different enzymes which are responsible for the constriction of the blood vessels, and dilatations mean there are some enzymes which are responsible for dilatation of the blood vessels, and this is important for the constriction and dilatation for maintenance of your blood pressure. All right, Swati, did you get it now? All right, okay. Anything else you want to ask? Anyone? Or else I will ask. Which organ maintains your body temperature? Tell me. Hypothalamus, pituitary. Hypothalamus. No, dopamine doesn't come under medulla. These are the hormones, they are secreted. Okay, body temperature is maintained by hypothalamus, right? Okay, okay. Okay. All right. Okay. Which is the stress hormone? Which hormone is called as the stress hormone? Cortisol, right? Cortisol is called as the stress hormone. All right. Okay. Okay. What is the function of glucagon? Increase the blood sugar, right? Okay. Name some exocrine glands. Tear glands, you said. Name a gland which is exocrine and endocrine both. Pancreas. Pancreas. All right. Okay. Okay. All right. So we'll just recap. Most of you have almost understood everything. So we started with the understanding of some basic terms in anatomy, right? Some basic terms. Okay. What is anatomy? What is physiology? What are the functional units of your body, right? How your organ system is created, generated. Okay. Which are the different positions or the terminologies used for the positions, anterior, posterior, What does it means? Then we have studied the different planes, body planes that we have, all of us. Then we have seen about the different cavities, body cavities like abdominopelvic cavity, thoracic and cranial cavities. What are the contents in these cavities? All right. Then we studied about the components of blood, RBCs, WBCs, and platelets, plasma. Okay. Then we have studied their functions as well, their lifespan and where they are destroyed. All right. Then we also studied about the systems of the body. We started with the endocrine system, different endocrine glands and organs that are present in our body, their functions, their secretions. Okay, what all are their functions, which is the master gland, how it affects all the organs. Okay, then also we have studied about different pathologies. Especially you have to keep in mind hypothyroidism. You have to keep in mind the difference between artery and vein, which are very common things. All right. Then we have studied about nervous system. Okay. Complex nervous system, that is nervous system central and peripheral, which you all know, which are the different subdivisions of the peripheral nervous system, how it functions. Okay. How all of these functions. Then different parts of the brain, okay, frontal lobe, parietal lobe, occipital lobe, and temporal, cerebellum and medulla, their functions, what will happen if they are not functioning properly, how it is covered with different types of meninges. I just forgot to tell you one more very common pathology, that is meningitis. Okay, very common pathology, meningitis, bacterial meningitis or viral meningitis. Okay, that is the inflammation of meninges, right? So this is one of the pathologies which is common, meningitis. Then we have seen the function of cerebrospinal fluid. Then we have seen different pathologies, genetic disorders, congenital disorders, acquired disorders, age-related disorders. Okay, these are Alzheimer and all these are age-related disorders. Also, we have studied a diagnostic test and then we have done the recap. Anything you want to ask me? Anything related not only for today's session, but if you have any doubt from yesterday or the day before yesterday, that is session 1 or session 2, you can definitely ask me if you want to ask anything related to what we have covered till now. If you want to ask anything like anything related to ICD or CPT, okay. If yeah, any questions or anything, or else I'll ask emergency. EMG, because I heard for the first time, EMG. Oh, it is electromyogram. Actually, how the muscle reacts to the impulse. That is recorded. That is called electromyogram. Myo means muscle. Okay. What they do is they stimulate a muscle or the nerve with a needle or a pin, and just to see how this impulse is carried out through the muscle and how the muscle reacts to that impulse. Like when this is carried to the brain, the motor system, motor part or the motor division of the peripheral nervous system gets activated, and how this muscle responds to that electrical impulse, how this impulse is carried, where is the problem, whether it is in the carrying that impulse from the muscle to the brain is a problem, or carrying the impulse from the brain to the muscle is a problem. That is seen, and it is done for the group of muscles, not for single muscle, but for the group of muscle. Okay, that is electromyogram. Electroencephalogram, EEG, encephalo. EEG is electroencephalogram. You are studying the brain, mapping of the brain, activities of the brain, mapping of the electrical activities of the brain. That is EEG. What is ECG? ECG? What is ECG? Electrocardiogram. Yeah. Mapping of the electrical activity of the heart. Electrocardiogram. What is EKG? EKG? EKG. Do you know or not? If you don't know, at least say no. What is EKG? No. Kidney related. No kidney related. No kinetic gram. Nothing. It is another name for electrocardiogram. It is another. It is spelled EKG. In some of the countries, they write EKG, not ECG. Some countries like Australia, Europe, they write EKG. Okay, it is same as ECG. Electrocardiogram, it is another name for that. Okay, all right. Now you tell me, if you see a code which is alphanumeric, whether it is ICD code or CPT code. ICD code, CPT code. Why not HCPCS code? ICD book you will be getting, okay? ICD book, because without that ICD you wouldn't be able to study. So when we start with the ICD, I'll be able to tell you more about ICD. What do you want to know about ICD book? What do you go through the session? Recorded session might be available on the LMS. You go through that, and if you don't understand anything about the book, the structure, we will be anyways discussing in detail about the structure of the ICD, the code, the book, how to assign everything, how to find, how to locate, all of that we'll be discussing. Only numeric, where will you find? Only numeric? CPT. Which are level 1 codes of HCPCS? Okay, level 1 codes are CPT codes. All right, very good. You all are studying. Very nice. All right. Who publishes CPT? Okay. How often HCPCS is updated? Every quarter. Quarterly. Very nice. Okay. Very good. All right. And how often CPT is updated? Annually. How often ICD is updated? Annually. 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 All right. All right. Okay. October 1st every year. Very good. Right. Okay. All right. So if you have any doubts, just let me know, or else we have completed for today's session. We'll be completing some basic anatomy related to different organs or different organ system tomorrow. Any doubt, anything you want to ask? For attendance, I think the link was shared. For feedback form also, the link was shared. Those who are raising their hands, just please put the questions in the chat box. Yes. I hope there are no doubts, no queries. No doubts, no queries related to any of the sessions till today, right? All right. So just fill in this attendance form. Also fill this feedback form. Okay. All right. Thank you so much. Thank you so much, dear. Thank you.
Yeah, thank you, ma'am.
Thank you so much.
So, yeah. Thank you for your valuable class. We'll meet again by tomorrow at 7 p.m.
Yes,
So, yeah, thank you.
thank you.
So students, we are done for the day as we completed the session. As you all know, tomorrow you have to join again on 7 p.m. Okay. So right now I'm sharing the attendance link once again on the chat. If you missed out to mark an attendance, kindly mark your attendance. As you all know, attendance is very important. So without any fail, mark your attendance. I'll wait for 2 to 3 minutes. So mark your attendance, and if you don't have any questions to be asked for me or for your trainer, you can just ask. If you don't have any, you can drop the session after marking your attendance. So we are done for the day.
Thank you, Sushmita. I'm there for a couple of minutes. If anyone is willing to ask any question, I'm there. Okay, or
Yeah.
else you
Yes,
can
ma'am.
disconnect.
We'll wait for 2 to 3 minutes. If they
Yeah,
have question, they can ask it out.
yes, I'm here.
So
So if
we'll.
anyone has any doubt, any question, you can certainly ask me. I think you can go through the videos also. Recorded videos are there, right? So you can go through that. And if you feel that if you have any doubt in the previous sessions also after going through the recorded sessions, again you can ask me. You can ask the question. I mean, if you raise your hand, I will not be able to understand. So, those who are just raising their hands, you can ask the question rather than raising their hands, right?
Ma'am, is there any question to be addressed?
I didn't get any questions,
Any
Sushmita.
questions? Okay.
Yeah,
Yeah,
I,
even for me, I did not get any questions. I think the
I,
students don't have any questions
yeah.
to be addressed.
Because I can't
So
see
yeah,
the questions on YouTube or anything. If there are people on the Zoom, I can see their question. If there are people who are attending through YouTube, you may share their questions if they want to.
no, there is no questions to be addressed. There is no more questions.
Okay.
So I hope we are done for the day. We'll leave for the day, ma'am. Yeah, thank you
Yes.
so much.
Okay.
We'll meet
Thank you
again.
so much, Sushmita. Thank you for
Thank you.
coordination. Thanks.
Yeah, thank you.
Thank
Yes,
you.
students. Yeah. So yeah, we are winding up for the day. Thank you all. Thank you for joining this wonderful class. We'll meet again by tomorrow. Thank you, everyone.